Welcome back, everybody. I'm making this video kind of quickly just to cover a topic I probably should have covered before. I've just kind of been both because I was busy for some of the holiday weekend and because I haven't been feeling very well. I kind of have like a some sort of a cold or something. Uh, still trying to give more of a final push for the last week of the year at work. Um, but I am probably going to do another video tonight, uh, but this one specifically about the individual mandate repeal in the tax provision, and it's a topic that I still think is probably the most important one that I cover on the channel. Haven't been doing a lot of content lately, but if you think about it, Obamacare is kind of the keystone of the past 8 years of policy Houdini that President Obama did when he was in the White House. He kind of would give his constituents and his voters this illusion that he was doing something that was for the benefit of everybody, and in reality, this was a policy that benefited very few people. In fact, a lot of people who are defined as beneficiaries of the policy are technically not benefiting from it because they're paying exorbitant rates on insurance for both premiums and deductibles. This is kind of a topic that's led me to start learning a little more about how insurance works. And I think if many people would have studied it earlier, uh, perhaps it never would have happened. So the individual mandate was repealed under the new GOP tax bill. And what that basically means is that the American people will no longer be fined for not buying health insurance should they choose not to. So I'm going to read through Fortune magazine, which has the most impartial summary that I can see of it, and then we're gonna address some of the clowns that are prognosticating about it. So here we go. Says a GOP tax bill repeals Obamacare's individual mandate. Here's what that means for you. The GOP's new tax bill, which passed Congress on Wednesday afternoon after one last vote in the House of Representatives and will be signed by President Donald Trump, is also a health care bill. The tax bill does at least as much, if not more, to upend Obamacare or the Affordable Care Act and even all of the Trump administration's 1,000 cuts to the health law over the past year by repealing the individual mandate, which raises the question. Just what is the Obamacare individual mandate and what does it repeal? What does its repeal mean for Americans? For starters, contrary to a statement that President Trump made Wednesday nixing Obamacare's individual mandate, that does not mean that Obamacare has been repealed in the GOP tax bill. So the individual mandate, which requires most Americans, other than those who qualify for a hardship exemption, to carry a minimum level of health insurance, is actually still in effect for 2018, meaning that you may have to pay a steep tax fine if you don't have health insurance, for one thing. And even after the individual mandate repeal goes into effect the following year, Obamacare's individual insurance markets federal subsidies to help Americans pay monthly health insurance premiums and Medicaid expansion in the dozens of states that implemented it will all still be in effect, barring further congressional action. Repealing Obamacare's individual mandate won't affect most people. That's because of ACA. So this is a paragraph I love. Repealing the Obamacare's individual mandate won't affect most people. That's because the vast majority of Americans receive health coverage through their employer or through a public health program like Medicare, Medicaid, or military health services. Obamacare's private individual health insurance markets, which again will still be around after the mandate is gone, and more than 70% of consumers can purchase government subsidized plans in them, will go through some turmoil, though. Those markets are meant for people who don't have access to employer coverage but make too much money to qualify for safety net programs like Medicaid, or Americans who are self-employed. And then it shows these tweets. I didn't see. Yeah, it says Trump says the United States Senate just passed the biggest in history tax cut and reform bill. Terrible individual mandate of Obamacare repealed. Goes to House tomorrow morning for the final vote. If approved, there will be a news conference at the White House at approximately 1 p.m. And then Kamala Harris said, because Republican efforts to repeal the Affordable Care Act failed, they're trying to turn this tax bill into a health care bill by repealing the ACA's individual mandate. 13 million more people will become uninsured in the next decade, and many face premium increases of up to 10%. The entire point of Obamacare's individual mandate is to make sure that it's not just sick people who are buying health insurance in these markets. By widening insurance risk pools to include a mix of young and old, healthy and sick, premiums go down in the overall market, and people don't simply sign up for insurance when they're sick only to ditch it when they don't need coverage anymore. Then it says, ultimately repealing Obamacare's individual mandate would cause 13 million fewer Americans to be insured in 2027 compared with the current law, according to the nonpartisan Congressional Budget Office. Healthier and wealthier people may choose to forego coverage, and even poorer, medically needy people may not sign up for insurance because they don't know which options are available, and there may not be the same sense of urgency to enroll without the mandate. The CBO also predicts that premiums in the market would spike 10% without Obamacare's individual mandate, as the exchanges are left with a sicker consumer pool. However, for most Obamacare enrollees, those making between 100% and 400% of the federal poverty level, an accompanying increase in federal subsidies will make up for higher premiums. Those making above that income level, we're almost at the end, about $48,000 for an individual or $98,000 for a family of four, will have to face the brunt of premium increases, though. So let me dissect now that, hold on, let me see here. I'm just pulling up the window so I see how much time has gone by. There is no chat because this is private at the moment. So just try not to make this too long. Anyway, there are a few points where I can clearly see that this article still has not processed the fact that Obamacare is a failure, and it always will be a failure, because look at it this way. First, in paragraph 2, it says repealing Obamacare's individual mandate won't affect most people. That's because the vast majority of Americans. So already we're off to the point where Obamacare has been a tremendous waste, because it's insured 13 million people. But what cost? At what cost are we insuring 13 million people out of a population of what? There's like 300 million people in the United States. So we spent this tremendous amount of money to give corporate welfare to insurance companies, and the premiums are still going higher, the deductibles are still going higher, the plans are still falling apart. You know, people lose their insurance all the time under Obamacare because the insurance companies say, well, fuck this, you know, we're going to pull out. They do it all the time. And you can see my videos from earlier this year, they all feature you know, dead zones in the United States, especially in states like Tennessee, where I think eventually they did get some coverage. Iowa, I think there's only four or five counties that have Obamacare in the entire state of Iowa. It's not really a program for all Americans, and it was ill-conceived to begin with. And I don't have to go through the whole rant that I have in the past, where, you know, I've yelled at the screen basically because people still believe that Obamacare gives health care to poor people. No, Obamacare gives overpriced health care to people that are not poor. They're barely above the poverty level, which it goes on to say in paragraph 4. And in paragraph 3, it says the entire point of Obamacare's individual mandate is to make sure that it's not just sick people who are buying health insurance in these markets. By widening insurance risk pools to include a mix of young and old, healthy and sick, premiums go down the overall market. Well, that never happened. Obamacare has been in effect since 2013, and this is precisely the reason that Obamacare has been a failure, because the healthy, the young, the young and healthy, or those that are able to afford Obamacare but don't necessarily need to use it, decided of their own volition, well, we're going to take the penalty. We're going to take the penalty, and we're not going to buy Obamacare. So that was money that basically the government took for free. Meanwhile, the insurance pools themselves were a failure, because that money doesn't go to the benefit of that insurance pool that as Fortune describes. Fortune magazine says the risk pool needs some healthy people in order to make it healthier. Well, with the individual mandate, people were willing to take the penalty, so that money went to the general fund apparently, or somewhere else, not to the insurance risk pool, and that's it. And these fucking plans fell apart, and entire marketplaces of Obamacare fell apart. And it's been a disaster to begin with, and I used to drive me nuts. I'm happier now, because I think that Obamacare is going to be completely repealed. A couple more words on this article. It said ultimately repealing Obamacare's individual mandate would cause 13 million fewer Americans to be insured in 2027 compared with the current law. Well, that's a very, very rash prognostication, because it's assuming that the 13 million people insured under Obamacare today, first of all, that they won't have certain changes. They'll get a different job and find a different type of health insurance. It could be, to look at a worst case, something that would be bad if some of these people would become poor and require Medicaid, okay, or Medicare, because they'd age into the Medicare market. Or for whatever reason, they develop a disability, God forbid. There's other people don't remain with a healthcare plan for 13 years. So, I mean, they may, but it's certainly not as often as it used to be. This is a very shoddy and simplistic view of the health insurance market, and even somebody, I can't claim that I'm an expert on the insurance market, but I can claim that through Obamacare, I've seen how deceptive and and just dishonest the media has been about the nature of the insurance industry, because they're claiming that over 10 years, 13 million people will lose their health insurance. Well, no, what this means is that there will be drastic changes in the market. Obamacare may survive. Technically, it's definitely shifted, and we're going to get to that. It's whether it's dead or not dead. That's a good question. So, Fortune is trying to make the case that Obamacare is almost like some sort of a new organ. It's like your spleen, and you're going to lose your spleen or something, because this undercuts it. No, people are able to get onto other insurance plans. It's difficult in some cases. Like they said, self-employed people, that it is really a problem. But there are alternatives, which they never mention. and there's people who advocate for universal health care. The people defending Obamacare are actually hindering that goal. I'm not in favor of universal health care. But for those of you progressives that are out there, I always try to mention this. If you want universal health care, then you don't want to defend Obamacare. It's actually a step in the wrong direction. It really is. It doesn't help people on my side that believe in free market insurance, or even replacing the insurance system with what is it? It's called like a fee-based a fee-for-service system. So, it actually behooves people from different viewpoints to do away with Obamacare and start promoting other solutions, and solutions that are peripheral to the insurance coverage issue. Solutions that are outside of that issue, such as the AMA's throttling of the medical profession, preventing new doctors from entering the market, and pharmaceutical companies and their price fixing of certain medications. There's a lot to talk about, but it doesn't get talked about because Obamacare remained, it became and has remained the key distraction and obstruction to getting improvements in in public health in America, to put it simply. So we'll move on to the big debate of morons, as I'd like to call it, between Vox. Vox is they're usually these cream puffs that publish articles where you're being mean to Hillary Clinton. That's basically that's their headline every day. People are mean to Hillary Clinton, or people don't appreciate President Obama. That's basically their attitude towards what's going on in the country day to day. And they published this article, I think a day or two after the bill passed, and it said, Obamacare will survive. It won't be pretty, but the law might really finally be in the clear. Now, I read this once before, a few days ago. It's kind of going to be still a little fresh for me. But I want you, while I'm reading it, to put in your mind, what exactly is the goal here? Is the goal to give more affordable health insurance to more Americans, or is the goal to preserve Obamacare? Because those aren't exactly the same goal. It says the Affordable Care Act is going to survive. Republicans repealed the law's individual mandate in their tax plan, but after Doug Jones won the Alabama special Senate election, the bare Republican Senate majority seems to have no viable path left for a more substantial repeal plan. Healthcare lobbyists are flatly dismissing the idea that Congress could have actually revisit Obamacare repeal next year. Senator Susan Collins of Maine and Lisa Murkowski of Alaska, both Republicans, remain opposed to taking up repeal efforts. Senate Leader Mitch McConnell, Republican of Kentucky, said this week that Republicans would probably move on from repeal next year. The party's long sought talking point of repealing Obamacare root and branch is probably actually finally dead. President Trump claimed after his party's tax overhaul that Republicans have essentially repealed Obamacare, but he's wrong about that. Repealing the individual mandate is a legitimate blow to the Obamacare marketplaces, but doing so won't unravel the markets entirely. They will function worse than they did before, and premiums will rise. But millions of people who receive generous tax subsidies to buy coverage will not feel the brunt of those cost increases. The laws and rules prohibiting health insurers from discriminating against pre-existing conditions remain on the books. Finally, and most importantly, Obamacare's Medicaid expansion, which covered upward of 15 million people, remains untouched. The heart of the ACA has always been the Medicaid expansion, the premium subsidies to make insurance more affordable to lower income people, and the protection for pre-existing conditions. Larry Levitt, Senior Vice President of the Kaiser Family Foundation, told me those things will all still be in place. Obamacare won't function as well as it might have under a Democratic administration. Oh, geez, geez, Jiminy Wilkers, I hope, I wish it functioned as well as it did under Barack Obama when premiums jumped by over 100% for some people. Anyway, or if Republicans in Congress weren't bent on repealing the individual mandate, but it will still be here. It says Republicans don't have the support to revisit Obamacare repeal. So it goes into basically, it goes into all of the failed efforts by Lindsey Graham and Bill Cassidy that were, and I have to say that they were pathetic. It said they had already failed to draft health care legislation that would pass the Senate when they had 52 Republican senators. Now they have 51. Jones might come from a deep red state, but he has said repealing and replacing Obamacare is just a political slogan that is not workable. Some of the senators who helped kill those previous repeal plans don't seem eager to take up the issue again. Collins told reporters Wednesday that she still didn't think the Graham-Cassidy plan was the right approach. Murkowski seemed to feel the same. So those are two senators who, by the way, they're only fighting against repealing Obamacare because they're Planned Parenthood supporters. So then it said, I surveyed 4 healthcare lobbyists well attuned to the congressional Republicans after Jones's win, and 3 of them flatly said that Obamacare repeal was dead. The other offered only that they might indeed try again, giving the GOP's existential opposition to the health care law. But ironically, the sweeping tax bill Republicans are poised to pass, which also ends Obamacare's individual mandate, could actually make it harder to repeal the rest of the law. Republicans will have nixed the least popular part of the ACA, the part that has been the foundation of their ideological opposition. And then it goes on to talk about Ted Cruz. It says the IRS tax the individual mandate from Obamacare is profoundly unfair. It says if they were to go back to Obamacare repeal once the mandate is gone, they would be tackling the much more popular pieces of the law, the provisions that have already made it so difficult for Republicans to unwind the ACA. It says I don't see how they get so then it just keeps going through, the different machinations that are going on. It said Obamacare is more than the individual marketplace. Republicans do seem primed to repeal the individual mandates too soon, unless other issues help derail, blah, blah, blah. The law's individual mandate marketplaces aren't going to work as well without it, but they probably aren't going to collapse either. Most policy experts already think 2 things. The mandate is too weak to compel more people to buy insurance. For many who might be on the fence, it is still cheaper to pay the penalty than to purchase health coverage. And then 2, most people who don't receive subsidies are being priced out of the market. The people who remain in the market receive subsidies that protect them from rising premiums without the mandate. So let me see if there's anything else, and then I'll return to this. It says Obamacare markets without the mandate are likely to shrink to the people who receive generous subsidies. Oh, this is good shit. They don't realize what good shit they're putting here. And sick people who really need insurance. That is not an ideal market, but it still means millions of people will be able to afford comprehensive insurance under the law. What is basically happening is that Trump is turning ACA into a public insurance program by getting rid of the unsubsidized population. Jonathan Gruber, an MIT professor who helped design the law, told me, is basically turning into an expensive entitlement for low-income populations. But then you have the rest of the law still in place. Obamacare expanded Medicaid eligibility to cover everybody with an income up to 133% of the poverty level, or about $16,000 for an individual. It has covered more than 15 million people, according to the Kaiser Family Foundation, making up more than half of the coverage gains under the law. So this is, again, another admission. So let's go blow by blow here. It says the mandate is too weak to compel more people to buy insurance. So therefore, even with the mandate in place, it was not enough to get more people to sign up for Obamacare. So this is essentially an admission that Obamacare, as it was designed, was a failure, and that it wasn't, people were not buying into it. And therefore, what is the reason to keep the individual mandate? The only reason is to keep, kind of an acceptable amount of people that are not the sick and especially needy and poor on the plan, or relatively poor among the people, in the lower scale of the economic ladder, but not yet poor. So those people that were contributing, the whole point of the mandate was to force them into it in order to keep the rest of it affordable. But it didn't work. So what's the point then? The mechanism has been proven to be a failure. So then why are you defending it? Not only was it proven to be a failure, it was tremendously unpopular. And it follows that we now can see that forcing people to buy something, especially private health insurance, is something that should no longer be considered a good idea in the United States of America. That's a perfect reason why people turn towards other solutions, including universal health care, which I oppose again, and including health savings plans and other things. Um, Number two, most people who don't receive subsidies are being priced out of the market. Again, you need tremendous corporate welfare from the government, subsidies. You need to pay these insurance companies blood money, basically, in order to get them to sell affordable health care. That's the flaw of Obamacare. It's really it. I mean, you don't even have to uncover the scandal. They basically state the flaws out front and pretend that they're not flaws. Then you have Jonathan Gruber, who is a fraudster. He was practically convicted of fraud in Vermont, had to return money after overbilling the state of Vermont for a healthcare study where he was claiming he was working more than he did. And he comes out and says, but then you have the rest of it says, what's basically happening is that Trump is turning ACA into a public insurance program by getting rid of the unsubsidized population, is basically turning into an expensive entitlement for low-income populations. Well, otherwise it would have been expensive and very poorly functioning health insurance for the unsubsidized people. Okay, why should people pay higher rates with no subsidies and with higher deductibles, and then they get screwed, and oftentimes their plans get canceled. Okay, this is the bizarre justice of the left, or the Obama left, I guess, because the universal health care people, they know in the back of their minds that this is wrong too. They just won't step out and definitively condemn it. That's why they don't have any integrity. They can't explain why it is that people with unsubsidized healthcare plans should have to pay such crazy rates in order to pay for other people with subsidized healthcare plans that are basically pouring more money into the insurance companies. So the Obamacare that will remain. So then another thing that he said is, but then you have the rest of the law still in place. Obamacare expanded Medicaid eligibility to cover everybody with an income up to 133% of the poverty level. It has covered more than 15 million people, according to the Kaiser Family Foundation, making up more than half of the coverage gains under the law. What this phrased differently, this means that what Obamacare did, the main accomplishments had nothing to do with the actual program called Obamacare, called the Affordable Care Act, and healthcare.gov and the individual marketplace and whatever. 15 million people receive Medicaid under the expansion. Medicaid is a totally separate program. That was under the Obamacare legislation, but the actual program insures only 13 million people. So therefore, if Donald Trump wanted to, and I don't know if it's the best idea, but it's going to be hard. I agree with Vox on that count. It's going to be hard to repeal the Medicaid expansion. If Donald Trump wants to just say, "Oh, I'm just going to keep the Medicaid expansion," the problem solved. Okay, but the Medicaid expansion is not the designer. That's like saying you buy the convertible in order to get the bumper. Okay, it did not. The ACA did not work because of the Medicaid expansion. The Medicaid expansion was kind of like a contingency that they put in because they wanted more people to get into Medicaid in order to bump up the numbers, and they've been artificially using that statistic in order to kind of juice the stats in Obamacare. The reality is that more than half of the people that are claimed to have been covered under Obamacare were covered basically under Medicaid, not under the individual marketplace or the employer-based marketplace. So the Obamacare that will remain is the one that still covers more than 20 million of the poorest Americans. Other Republican-led states that have so far rejected the Medicaid expansion could revisit their decision the longer the law stays on the books. We're going to end up seeing effectively the ACA will become an expansion to the social safety net, said Craig Garthwaite, a conservative health economist at Northwestern University, told me. We've really closed out a lot of the holes in the safety net for the truly poor. The rest of the law's infrastructure will still be there too. Insurers will. So again, this is not now. If more people get jobs that include health insurance, or if more people buy health insurance on a non-ACA market, then these numbers don't mean anything. This is assuming that people do nothing. That's dumb. That's basically less than first grade economics. That's it's retarded. They're assuming that people are not going to, I mean, it could, I mean, people's situations could get worse. There could be more people on Medicaid for whatever reason. This is ridiculous. They're trying to say, oh, that people are not going to be able to get health insurance. Well, some people won't, but you can't say that the 13 million people will lose their health insurance and nothing will happen besides that. The rest of the law's infrastructure will still be there too. Insurers will still be legally prohibited from denying people coverage or charging them higher premiums based on their medical history. It could make it easier someday for a future Congress to take steps to improve Obamacare, either by reinstituting the mandate or by expanding the tax subsidies to make insurance more affordable to more people. So yeah, that's about it for this Vox article that I'm not gonna keep going. It goes on for quite a while. But what they're really talking about is that the structure of the Affordable Care Act will remain. What they don't realize is that what does that really mean? It means that Trump has basically put up a gamble, and you can't guarantee that the gamble is going to work. But it's this: that with a thriving economy and with more Americans keeping more of their tax money, they will ultimately produce enough jobs. There will be enough GDP growth to spur, a smaller pool of unemployed people, and more of those people will receive employer health care coverage, and therefore, with an economic boom, or with a boost in investment, a boost in consumer confidence, a lot of these issues will buoy the health insurance market. Now, another thing that they don't take into account is that elements of Obamacare can still be, tweaked piece by piece. There's the stuff. I hope that he does it, but there's the issue that Trump has talked about in the past. I'm not aware of what happened with that. That he will eliminate the restrictions on selling insurance across state lines. That could help a lot. What is the reason that you can't sell insurance across state lines? You can sell car insurance across state lines. You can sell home insurance across state lines. There really is, in my opinion, there's no justification for it, and it kind of, I believe one of the reasons is because state medical boards objected to it or something. I'd have to look more into it, but we're really talking about, when you look at Vox and even Fortune in that article, you're talking about people that are thinking small. They're not thinking about really the underlying problems of the healthcare crisis with Obamacare. The last article, let's see how long it is Paul the fuckhead Krugman. He has this article that says, 3 legs good, no legs bad. Let's see how much time I've been going. 34 minutes. That's not good. Oh well, I guess we'll soldier on. But it says, will 50 Republican senators be willing to inflict grievous harm on their constituents in the name? So Vox says, oh, Obamacare will survive. This is Paul Krugman, one of the biggest advocates for the individual mandate, and he this is from July, so it's not news, but this is when they were talking about the individual mandate back then. He says, I have no idea, but this seems like a good moment to review why Republicans can't come up with a non-disastrous alternative to Obamacare. It's not because they're stupid, although they have become stunningly anti-intellectual. It's because you can't change any major element of the Affordable Care Act without destroying the whole thing. So that he's basically saying that you can't. This is a guy who's always talking about he's talking about fixing the Affordable Care Act, but then he says you can't change any major element of the Affordable Care Act without destroying the whole thing. So how do you fix it? Then he says, this is a guy, by the way, I used to do a segment sometimes called, Quackonomics, where I'd make fun of Krugman. I might have to bring it back, because this is a Nobel Prize winner basically talking to America as if they're a bunch of toddlers that just shat their diapers. It says, suppose you want to make health insurance available to everyone, including people with pre-existing conditions. Most of the health economists I know would love to see single payer or Medicare for all. Realistically, however, that's too heavy a lift for the time being. Well, why is that, Paul Krugman? Maybe you should explain to those people that are in favor of health care for all, single payer, why it's. I mean, you passed a piece of shit bill like Obamacare. You might as well go. I mean, there's no reason if you passed a total turd like Obamacare, and you've been writing about it for 5 years, and it's a complete failure. There's no reason you can stand in the way of single payer. That's the problem, because you managed to come up with a system that's worse. For one thing, the insurance industry would not take kindly to being eliminated and has a lot of clout. So you're saying, oh, we have to go along with the desires of the insurance industry. That's why we can't have Medicare for all. Well, essentially what this means is that Obamacare was used as kind of a middle. It was kind of a Frankenstein monster that was made to appease dumb constituents, and that's not my words. That's the words of Gruber. Jonathan Gruber was in the previous article, who said they depended on the stupidity of the American people in order to make it pass. And he basically admitted that they have to bail it out all the time. So it's not, there's no mystery here. They've revealed themselves time and time again. Also, a switch to single payer would require a large tax increase. Most people would gain more from the elimination of insurance premiums than they would lose from the tax hike, but that would be a hard case to make in an election campaign. So Paul Krugman is basically saying, I think single payer would be a better idea than Obamacare, but because people are too dumb to realize that they would save more by getting free health insurance than they would by paying higher taxes, then geez, I guess we can't have single payer healthcare. This is by the way, this is why progressives hate him, because he doesn't actually give them a better idea. He just says to them, well, your idea is better, but fuck you, because I can't sell it to people. Well, maybe that's because you're a shitty rhetorical person. I mean, you're shitty at getting your ideas across, and you don't know how to convince people. You have zero charisma. That's maybe why. Beyond that, most Americans under 65 are covered by their employers and are reasonably happy with that coverage. They would understandably be nervous about any proposal to replace that coverage with something else, no matter how truthfully you assured them that the replacement would be better. So the Affordable Care Act went for incrementalism, the so-called three-legged stool. It starts by requiring that insurers offer the same plans at the same prices to everyone, regardless of medical history. This deals with the problem of pre-existing conditions. On its own, however, this would lead to a death spiral. Healthy people would wait until they got sick to sign up, so those who did sign up would be relatively unhealthy, driving up premiums, which would in turn drive out more healthy people, and so on. So insurance regulation has to be accompanied by the individual mandate, a requirement that people sign up for insurance even if they're currently healthy. and the insurance must meet minimum standards. Buying a cheap policy that barely covers anything is functionally the same as not buying insurance at all. So he acknowledges, by the way, that, so basically what he's saying is, yes, Obamacare is fucked. He's contradicting the Vox article. I mean, he wrote it before that, but what Vox is saying contradicts Krugman, because Krugman is saying that in order to get those people to actually even sign up, they have to be required to do it. Now, in practice, that was not true either, because people just took the penalty. So it ended up, the death spiral happened anyway. Krugman's contingency to avoid the death spiral was to fine you if you didn't buy health insurance. That didn't solve anything, because the fine ended up being less than the shitty overpriced insurance. Now, what was going to be the solution to that? Well, if Barack Obama, or sorry, if Hillary Clinton had been elected in 2016, they would have raised the tax. They would have raised the penalty. And it's known. It's known that the penalty would have been raised. I think it ended up being raised anyway. But what if people can't afford insurance? A third leg of the stool is subsidies that limit the cost for those with lower incomes. So we have, I mean, the first leg of the stool was the requirement of no pre-existing conditions. The second is the individual mandate. The third leg is the cost share reductions, or which are the subsidies. For those with the lowest incomes, the subsidy is 100% and takes the form of an expansion of Medicaid. That is, I mean, that's a funny way of putting it. The subsidy is 100% and takes the form of a, so you expanded Medicaid. Okay, why didn't you just expand Medicaid for those people and then come up with a better idea than this shit? Okay, it's two separate things. You can't go and take credit for expanding Medicaid for people that are slightly less poor than the people that were already on Medicaid, and then pretend that, oh, Obamacare helped solve that issue for those people. Well, it fucked a lot of other people. So what does that have to do with expanding Medicaid? The key point is that all three legs of the stool are necessary. Take away any of them and the program can't work. But does it work even with all three legs? Yes. No. To understand what's happened with the ACA so far, you need to realize that, as written and interpreted by the Supreme Court, the law's functioning depends a lot on cooperation from state governments. And where states have, in fact, cooperated, expanding Medicaid, operating their own insurance exchanges, and promoting both enrollment and competition among insurers, it has worked pretty darn well. Compare, for example, the experience of Kentucky and its neighbor Tennessee. In 2013, before full implementation of the ACA, Tennessee had slightly fewer uninsured, 13% versus 14%. But by 2015, Kentucky, which implemented the law in full, had cut its uninsured rate to just 6%, while Tennessee was at 11%. Or consider the problem of counties with only one or no insurer, meaning no competition. As one recent study points out, this is almost entirely a red state problem. In states with GOP governors, 21% of the population lives in such counties. In Democratic governor states, less than 2%. Well, that's not quite true. I mean, because in Missouri, which had a Democratic governor until last year, yeah, that did happen. And to say that this is because of that is not the point. Okay, there were, I mean, look at Illinois. Okay, Illinois, Obamacare. So Illinois' Obamacare marketplace collapsed in 2016. Yeah, they have a Republican governor, but he's by no means, a real conservative spender. I mean, in reality, Illinois state government is hugely in debt. It's controlled by the Democrats. There's a lot of states, Oregon individual marketplace collapse. Bring that one up. Yeah, and this is in July 2016. Now, Oregon is one of the most, so the entire model collapsed in Oregon, and it had to be taken over by the federal government. So Krugman's whole basis that it's because of Republican mismanagement of the whole thing, it doesn't hold. Okay, the whole plan, the three-legged stool, is a clusterfuck. It doesn't make any sense. So Obamacare is, though nobody will believe it, a well thought out law that works better, that works where states want it to work, and it could and should be made to work better. But Republicans show no interest in making that happen. Instead, all their ideas involve sawing off one or more legs of that three-legged stool. First, they're dead set on repealing the individual mandate, which is unpopular with healthy people, but essential to making the system work for those who need it. Second, they're determined to slash subsidies, including making savage cuts to Medicaid in order to free up money that they can use to cut taxes on the wealthy. The result would be a drastic rise in net premiums for most families. Well, there already have been rises in premiums for most families. So why do you have to claim that bad things are going to happen if X happens when they're already happening without it happening? You know what I'm saying? He's not even, cause and effect doesn't even exist with Krugman. By the way, for those of you that want like even like more in-depth stuff, you know, if you really want to nerd out on Krugman's idiocy, you should look up Contra Krugman with Bob Murphy and Tom Woods, these two economists. I listen to every once in a while. Yeah, I know it's not exactly the most riveting conversation for most people, but they really get into it. Finally, we're now hearing a lot about the Cruz Amendment, which would let insurers offer bare bones plans with minimal coverage and high deductibles. These would be useless to people with pre-existing conditions who would find themselves segregated into a high-cost market, effectively sawing off the third leg of the stool. So which parts of their plan would Republicans have to abandon to avoid a huge rise in the number of uninsured? The answer is all of them. After all these years of denouncing Obamacare, then Republicans have no idea how to do better, or actually they have no ideas at all. Well, notice how his principles work. He's saying that you need to penalize people in order to make other people be able to afford insurance. He's saying that you do need to subsidize health insurance companies, you know, basically give corporate welfare in order to make these plans affordable. Even though he acknowledges that in his mind, the Obamacare would not work as well as universal health care. He says, oh, it's not sellable. Well, if it's not sellable, then find somebody to sell it if you think it's so much better. I don't think it's better, but you do. So why this whole charade that Obamacare is better? It's not better. And the idea that the individual mandate would drive people to buy the insurance who were healthy. Well, it's been proven to be wrong. It's been proven to be wrong, and he contradicts himself several times here. You know, the fact of the matter is that we know that many young people and people that are healthy decided not to buy health insurance and take the penalty. So Paul Krugman is you know, dishonest to a fault here in so many ways. And finally, the whole idea that you need all the plans to be the same, and therefore everybody should buy the same expensive plan. Well, then why should people who don't need something? It's like saying, you know, Jeff, if you need, I know that you're good enough driving your Mazda 6 because it gives you good gas mileage, and you don't need a larger you know, sedan or whatever. But you know, you have to pitch in with everybody. We can't afford to give people the less expensive car. Some people need a car for that can fit 6 or you know, has more cargo room in the back, you're going to have to buy the Subaru Outback. That's the attitude that they're approaching with this. Now healthcare, I acknowledge, is different from from automotive consumers or automotive the automotive marketplace, but it's saying that there has to be a one size fits all in order to satisfy the people that need it most. No, that's not true at all. In fact, if you look at it, the people that need the most specialized plans, that they'd probably do better to delete some of the other features too. You know, the neonatal care. If you're somebody who's had a hysterectomy, if it covers, you know, pregnancy or whatever, no, you shouldn't have to pay for provisions like that. It doesn't. It really makes no sense. In fact, it's an insult to people's intelligence. It's an insult to people that think about the markets, that think about business or whatever. So that's about it. I did go a little, you know, much longer than I thought I would, but you know, I thought it was important because, you know, we're going to have to really it's time to stop complaining for those of us that have opposed Obamacare for so many years, because we're going to have to start actually talking about the other elements that we're going to have to address. So, you know, we're jumping off into a new year, and ACA Today, I might have to come up with a new title for it, because the Affordable Care Act, in my opinion, is kind of you know, it's become incapacitated. So similar to my voice, but you know, we're going to have to see some more imaginative solutions, and you know, we're going to keep track of Krugman's hallucinations too. But yeah, I think that this is an important milestone, and we have to keep abreast of this and keep learning more, because obviously before I started this, I didn't know as much as I do now. I hope some of you have some ideas. Maybe there's something I forgot, or maybe there's a point that you think I got wrong or something. Put your ideas in the comments. Like this video, share this video. Check out my latest video on the Clinton Presidential Penitentiary Library series. There's also the video I did on the For Real News on the Russian Revolution, also in the description. And have a great evening. Hope to speak to you later. I don't know if I'm going to do another chat today, but we'll see. Good night, and Happy New Year.